Quality improvement projects in healthcare setting. Hello, my name is Okobi Edwards Okelwe. I am a research fellow at Lakeside Medical Center, Florida. I have a master's degree in clinical research. Oh, wait, did I forget to tell you that I am also a medical doctor? Oh, yes, I am a doctor interested in advancing medical care through innovative methods and research in the United States. Okay, let's get started. Today, we're going to talk about QIP. By QIP, I mean quality improvement projects in the healthcare setting. First, we have to understand what quality improvement is. Okay, let's build up our foundation on this topic. The philosophy and attitude of making something better is innate in man. The improvement business in healthcare has been around for as long as man lived on this earth. The science of improvement has been on a long road with better approaches and better systems. Several QIP has been achieved in the healthcare setting. Recently, a scientist named Don Berwick came along with others who wanted to translate the improvement in science to healthcare. He wondered if there were lessons from the system he observed in his pediatric clinic. He said that children and their growth development are constantly probing the environment with a constant curiosity, listening to the noise, arranging toys, or improving their speech. They are not in the job of solving the problems forever, but are continuously thinking about improving it. In his words, the system thinker is a perpetually curious person who never thinks they have the whole answer, but always willing to know what the next step to take is. He went ahead to co-found the Institute of Healthcare Improvement, which is focused on reducing medical errors. This innate nature of improvement in man drives us to better our healthcare system. For example, we as caregivers exhibit such an attitude every time we ask our patient to adjust their habits, take their prescription medication as prescribed, or stop smoking, or drink water, or don't drink, or lose your weight, or see your doctor regularly, eat healthily, and other good health habits. You will agree with me that these changes improve quality of life. We then can make these recommendations a routine practice and improve on it. If such a concept improves our patient's life, then it is a perfect example for improvement strategy. The Institute of Medicine defined quality as the degree to which healthy services for our individuals and population increases the likelihood of desired health outcomes that are consistent with current professional knowledge. So what is so question, what exactly is quality improvement? In recent expert working group defined QI in healthcare as a systematic data guided activities designed to bring about immediate improvement in healthcare delivery in particular settings. In the real sense of it, interventions that are known to be efficacious are put in place to benefit patients who receive them. Here are some historical examples. In the US, there have been several notable quality improvement efforts over the past half century. The academic health quality movement spawned a substantial number of these efforts. This was launched with a series of articles that began to outline deficiencies in the delivery of healthcare, which prompted numerous and multidimensional efforts towards healthcare quality improvements. Okay, let me not bore you with too many details. Here are a few examples. Hand washing. A recent QI project published in 2007 to improve patients' hand hygiene through the promotion and use of hand washing with soap and water, hand sanitizers, or both, in addition to patient education, to reduce hospital-acquired infection. This study concluded that increased hand hygiene compliance by patients can influence infection rates in adults, especially in thoracic step-down units. Another notable example was in 1966. Dr. Arvidis Donabaden, physician and founder of the study of quality in healthcare and medical outcome research, he published an article titled Evaluating the Quality of Medical Care, a replicable and highly useful model that relies upon the element of structure, process, and outcomes to examine the quality of care delivered. When applied to orthopedics, the Donabedian model suggests that care structures, for example, assigning a dedicated arthroplasty care team or care process, designing and implementing a standard arthroplasty care pathway, can contribute to improve patient outcome. So what are the types of QI projects? A plethora of quality improvement approaches or QI models exist to help you collect and analyze data and test change, and also implement this change. And all these QI models, they all overlap with each other. It can either be focused on providers, improving provider action, perception, behavior outlook, and service, or focused on patients, improving patient outcome, perception, behavior outlooks, and services. Or it could be focused on systems and others. Why QI? Well, okay, now we understand what a QI project is. But wait, why should I care? Who cares? I'm not the CEO who should be implementing QIP as part of their corporate objective. I am not Dr. Harberger, the program director, or Dr. Merdad, the DIO, who should. So why should I care? More so, I have my busy ward round, clinics, and life to live, so why should I even care? Okay, wait, let's find an answer together. First of all, we should care for the moral burden. If we desire improvement from our patient, how much more they expect it from us. More seriously, organizations that implement quality improvement programs typically experience a range of benefits. Improve patient healthcare outcomes and that involve both process outcomes and health outcomes. Sounds too complex. Well, another reason why we should find an answer. Let me put it bluntly and specifically. It is a requirement from ACGME that you complete a QI project before you graduate from your residency program. However, several other advantages exist. It reduces the cost of healthcare and avoids costs associated with process failures, errors, and poor outcomes. It improves efficiency of managerial and clinical process. It's been known that proactive processes recognize and solve problems before they occur to ensure that care systems are reliable and predictable. A culture of improvement frequently develops in an organization committed to quality because errors are reported and addressed. Now we know all this. What do we do next? Interesting. It's time to ask. So I suggest you ask yourself this first question. What, why, when, how, where do I act? You can choose any of the QIP models. First of all, model for improvements like the Plan, Do, Study, Act, the PDSA cycle. In this, the Institute for Healthcare Improvement model combines two popular QI models, total quality management and rapid cycle improvement. The result is a framework that uses PDSA cycles to test improvement on small cycles and scales. You can also choose the Six Sigma or the Lean process. Too complex, right? Well, allow me to summarize this model as what, why, where, when, how, and outcome. So let's get practical here using the PDSA model. Plan the test, do the test, study the test results, and act based on it. What are we going to improve and how much? Let's say we want to reduce the hospital admission rate for lower extremity amputations per 1,000 population of adult diabetes by 85 to exceed the US national benchmark. Okay, sounds great. What do we do? Why do we want to do it? Well, because it improves quality of life for our patients and we are behind the national benchmark. Okay, so how do we do it? Um, we can do this by adopting strategies that work and improve them, like like improving structured diabetic education or patient diet modification, improving HbA1c testing or compliance, or we could just simply choose to adopt more reliable prescription methods like once a day daily pill or automatic mobile pump insulins. Okay, so when do we do it? You have to choose a time specific. Let's say we want to achieve this by June 8th, 2021, or for in our short-term evaluation, or we could end up on the 20th of 2022 for long-term evaluation. And how do we measure the outcome? We measure the outcome and see if we move the needle. Sounds interesting and easy. Yeah. But what if someone asks you, how do we know that these projects will lead to change and improvement? Well, you just have to choose something, measure them, figure out how to improve them, and it's doable and reliable. It could be simple things like improving training models, hand washing, improving simple smile, better communication, or just an audit feedback. Just pick one and keep going. And as you go along, measure how you do. Adapt, adopt, or discard. That sounds so good. So what do we have to do now? In our hospital here at Lakeside Medical Center, we will work as a team to encourage and engage the human side of change. However, we anticipate some setbacks. Setbacks? Yeah, setbacks. What if some of the people we are working with are not ready for change, or they may not be as effective as our innovative drive? Or, well, I know, insane, right? Yeah, not everybody is ready for change. To some, it is not a priority. They are focused on charts and care plans and clinic. To others, it's just a concept of innovation fatigue. And often we are overloaded with daily routines or requests for practice change, and it could be very challenging and overbearing. You will understand that some of our natural inclinations are to provide change, but ambivalence for change is expected. So, building confidence and change agenda require careful listening, strategic questioning, and planning. Sounds very interesting. Well, my mantra for improvement is to take a page for the children. Just keep moving, keep taking the step, keep improving on it. I also love this specific about QIP. My most favorite is how can I make it easy to do the right thing? In Lakeside Medical Center, maybe easier, maybe something about sharing simple load or like merely adding a prompt to the reminders or training the MAs or maybe for help us in identifying these diagnostic challenges or doing these changes in incremental step rather than just rocket jump at first. Historically, the science of innovation is less of a giant cognitive leap and more of a stepwise implementations, building on the ideas of others and engaging our own genuine curiosity regarding what motivates and deters the individual and system pathways to change. Like we discussed with our program director, Dr. Harberger, it's hard to summarize quality improvement projects in one sweep, but I'll try. So, my main lecture takeaway today is start. Find something you can improve on and get going. It is time to devalue discouraging thoughts and entertain simplistic progressive actions. Ask yourself, what can I do by next Monday? Have a goal with a needle and start moving the hands on the needle towards the goal. I hope this makes sense. Thank you.